Yes.
The most important oxygen desaturation. We measure the oxygen level.
Yes.
And we can calculate what's happening during oxygen in the blood, if it is severe or it's a mild case of hypoxia or severe hypoxia. All of this, the patient come to us in what's called sleep lab.
Yes.
We connect them or connect him to the device and sleep in the lab for one night.
Yes.
And in the morning, we measure all of the record in the computer, analysis of all this data, from which we can diagnose obstructive sleep apnea.
So you diagnose the changes, and you also diagnose the cause of the sleep apnea as well.
Yes, we can from this polysomnography we can differentiate it. It is obstructive sleep apnea secondary to causes of obstruction for upper airway, or it is a central sleep apnea from the brain and there is no obstruction.
Yes.
We can differentiate from polysomnography.
I'm sure our viewers are very anxious to know how would you treat the sleep apnea.
Yes. First instruction, general measurement. Most of these patients with obstructive sleep apnea are obese.
That's true.
Obese. We measure body mass index. By obesity, by definition, it's a body mass index more than 27. First, to tell him, instruct him to decrease her weight by diet therapy or exercise.
Yes.
Decreasing weight is the main line of treatment. Second is surgical correction if there is a cause for obstruction, if there is division of the nasal septum, or if there is hypertrophy of the tonsil or adenoid, we refer him to ENT consultant for surgical correction. And we are using laser for treatment of the hypertrophy of the soft palate. And
it could be a small surgery that can spare a big problem, or a series of big problems.
Us from a big problem and more complication, protect from complication.
Yes, what else?
After general treatment, the main line of treatment of obstructive sleep apnea device, also we gave him a device what's called CPAP. And I have a small video here we can see how CPAP can act. As you see in the video, the flow of the air either from the nose or from the mouth through obstructed airway, and now we will connect him to the device, as you see, what's called CPAP.
Yes.
This device CPAP is a pressure. It is a pressure system. It will open the obstructed airway, as we can see now.
Yes.
By the pressure, it will open the soft palate and allow the air to pass simply from the pharynx. This CPAP is, we have two types of CPAP. Either it's connected to the nose, it's called nasal CPAP, or mouth, or through mouth DPAP.